I'm running around over here. So I will send it to you right now. But it looks like it's streaming. I can get it here, but I don't know. I don't want it to be. You know what I'm saying?
这坏掉了。
Okay. I will send it to you right now. All right. All right. I'll call you back in a minute. Okay. All right. Let me do it.
Just one.
Yeah, there's just one mic. So you're gonna. So what
Sure.
I do is kind of like set up the community, just hold it while you're talking. Okay. And then just pass it over when you do that.
Okay. Pass
Okay.
it.
So you're gonna want to hook into K19. I got to. I gotta. I'm way behind here. Way behind.
对，我把那个 video 那块删掉了。
早该删了。后面那部分还是你来讲。天哪！咋了？ Where'd the girls go? Are they? Is Jessica and them standing out there?
Yeah, they are all outside.
Oh, Jesus. Okay. Where?
Procedure.
Yeah. Well, you didn't turn them in, Tom.
把这些连贯起来。我本来是这么打算。
你现在说一遍。
When did I send you guys?
First, position the patient on the operating table and check the status of the patient.
你这样说爆炸。
啊？
这是什么鸡巴玩意？那上面。
Is this running?
它上面就只要有6步这个是简略的，它这里面就是详细的。
Hey. Just hold this, because I need to see if it's working, so
Okay.
that people can. Okay. Just talk.
Wait.
You don't have to put it that close. Just kind of hold it just out, like out here in front of you.
Okay.
Okay.
Wait.
All right. So what I want to do is there's a 30-second delay. Okay. All right. Cool. M&M's. Hello. I emailed it to you. You got to kind of scroll down. It's called Tiny AOL. AOL. Okay.
听你聊这么熟，还不如简略的介绍一下每一步是大概是干的什么。
就按照这6步来简略介绍了。
这6步你想一想怎么简略介绍？
Yeah. If you click on that, it should bring up a YouTube live streaming.
你把这些东西不要有这种 first 或者 next 出现，直接就是一个整体说出来最好。
整体说出来。
不然就是感觉在一点这个深度都没有。你是在给人介绍，而不是在读一个学术报告。
I can't move it at all.
后面都是什么东西？后面应该都好些。
后面应该都是每张 PPT 的一个部分全部隔开来了。主要地方的话，没有 insert two 我就介绍一下，就这边都要的。这一块开始要的。
我每个要说的词都已经。
你就到时候你是就照着读的那个对吧？
我是全部照着读的，因为我已经把我想说什么都已经写出来了。因为我知道，我如果直接看这种东西的话，我说不出来。哦。
喂。
Say hi, Mrs. S.
Hi, Mrs. S. 这个东西是坏掉的。
反正后面你说，我也不怎么搞。能怎么说怎么说吧，好吧。
Yeah, I know. It got moved. It'll move back. Give it time. It's like, literally, it's a 30-second delay. So. They will, but they haven't yet because they haven't hooked into the projector yet. Okay, so that was about 30. That was about 30 seconds ago. So with the microphone, everything's working perfect. Yes. Okay, perfect. I'm not going to move the camera. There, you can see the big screen. Everything's set up. Perfect. Thank you. I can. It's a webcam. There's no zoom, so that's the best I can do. Well, I'll have him put it up and I'll call you back. Okay. All right. Michael, what's up?
Is Keegan going to be around? Because which one of your sons played with Ben during football? Is that Keegan or?
Could be Keegan.
Is he going to be around? Because my mom's debating bringing Ben home, and she's like, "Is Mr. Solo going to be here?" She's like, "Did they just play on the walk or something?" I was like,
You can send him over to my house.
"Oh, really?
Yeah. I can ask Mrs. S.
Do you mind that?"
No, I think Keegan and Mikey are home.
Okay. Because
So.
she's just debating bringing him home or.
Yeah, give me a few minutes and I'll help you out.
All right, perfect. Thank you.
Yeah. Hello. Okay. Jesus Christ, this is what we're worried about here. Can you move those trash cans out of the way, please? Well, I'm not moving everything. I don't have time to do all that. What's up? Remember what? Oh yeah. Well, Ace's little brother. I have his sister in class. Ace's little brother his mom is trying to come home. Or is trying to come to the presentations, but she doesn't want to. She's already close instead of trying to go back and forth instead of taking him. So I didn't know if it was okay if they. Yeah, they played in football. Okay, good. I'm glad. All right. Well. All right. I'm not gonna deal with that thing. Okay. But you're good to go. You can. How does the screen look? You can't really see the screen. There's not much I can do. Can you hit the lights? Just hit one bank of lights. The light switch. Where? On the wall, right behind you. Behind you. On the wall. On the wall? Right there, the big blue red box. Red box. Oh, there you go. Just hit one. Yeah, hit that one. Just leave that one. How's that look? Does it look better? Yeah, you can't. Oh. Yes, I know I'm on the phone. Just trying to make sure that this looks halfway decent. That's all I'm asking right now. Can you fix your picture and put it in presentation mode? Because I can't there. Put it in presentation mode for me. How does it look there, Dan? Okay, it's a 30-second delay. You're going to have to wait a while. Yeah. Yes, I know it is. Trust me, I'm on the other end of this. I just don't have any way of putting it closer. The camera. It's on one of the tables, but there's not much I can't put it. I really can't put it any closer. Yeah. Yeah. Grab all this stuff. I know. It's weird. if that's closer. How does it look now, gentlemen?
This looks.
Can you at least read it a little bit? You just have to, guys are gonna have to stay, you know what I mean? You're gonna have to stay like on, even if we stay on either side of it, you know? Kind of.
Doesn't matter.我反正是我要把所有的东西都写上。我是零卡顿，可以说出来，无卡顿的。一个接一个，我的话6到7个你讲完了，后面全部都是你讲。你看一下你这个东西，你真的能弄出来吗？
啊，难不难的说弄不出来？
你听了2个，你确定能读出来是吧，兄弟？
那也可以读不出来，说实话。
你这个 procedure 你确定你这样介绍吗？
那你觉得应该怎么介绍？那我算了 procedure，
你尽量不要让他。
那算了，我 procedure 也不详细介绍，就介绍这6步，这样子行不行？
不是说想不想介绍，你这么读出来别人睡着了。
那就这6步，精简单，就主6步。
你最好不要照着它读，这是第一点不要做的事情，不要照着读。然后呢，其次呢，你再去简略的介绍它的部分，但是你现在可能你这个东西写出来你没法介绍，而你可以直接就说这个就是我们6个主要的一个步骤。但是这个很难搞，因为我没有猪的视频。你要说这个猪是怎么样弄开的？
这猪先拿手术刀切，然后把它底下那个连接的地方给切开，然后把肺拿出来，然后再换个新的肺进去，再缝上去。然后再缝上外层的一颗。
你到时候要拿英语说，你把那个肺，把那个猪的肚子切开是吧？然后呢，拿那个什么东西扣住它，你拿那个叫什么东西扣住它？拿那个叫。
那叫啥呀？那个我也不知道叫。
哎，兄弟，这个上面100%是有的，但是你不知道它是什么意思啊？是高号什么意思啊？
手术刀。
那其他的呢？
这些都是对人的。
这些是对人的，但是肯定有把它拉开的东西。forceps，
这是止血夹。
和一个 retractor。
Right, yeah. So you guys can't go past.
retractor。你先说明白怎么这个东西怎么把猪给拉开的。
Yeah, well, they
然后你
need to
再
be
说
like
把那
maybe
个
one on each side.
肺给切断。
那我干脆也不说人的那个了，人的手术过程，我直接说猪的。
你先跟他们解释一下为什么你要说猪的，因为我们只有猪可以做，是吧？你说这个是给人的，我们做猪的时候情况不同。那这个猪是怎么做的呢？是肚子切开，把这个肺给弄出来，肺拿出来了以后，再把肺放回去，再把它缝起来，缝2针以后，再把上面东西给缝起来，整个。
里面那层叫什么？里面那层，猪的那里面的哪一层叫什么？
那么2个，你不用说。
How's it look now? Can you read? Sure. Okay, so yeah, you can see that. It's a pig in a bed, but I mean, there's not much I can do. That's just it's just a bad camera. Yeah, it'll come back in here in a minute.
See me if I slant here.
Let me find out where he's at, and we'll go from there. All right. I'll text you really quick. All right. What can I do for you, Aaron?
Are we starting exactly at 6:45 or?
You can. I mean, if mom and dad are here, we're good to go. You guys can start a little bit early.
Okay.
If you want. That'll actually it would probably be beneficial.
Yeah.
Because my guess is some of them are going to be a little longer.
我觉得你的解释比较好。就说这个代替这个人去上手术台啊，拿这个手术刀，肚子切开，肺给掏出来，然后把肺再给换回去，皮肤缝上，好了，搞定了，就这么简单，就这么几个步骤，没什么步骤。没有那个图像的话，你得说的像有图像一样，明白吗？栩栩如生。
那你待会儿就躺在这边当我的猪，我来切你。
这边当你的猪，兄弟。
然后我来切你。
你到底这把解释不解释得了，兄弟？你得解释的，就是像是有这个视频一样的最好。那
我在介绍这个视频，那我在介绍这个过程的时候，我可以用第一人称的，应该就是可以用我了。
当然用第一人称，你不用说什么东西，肯定用
就
第一人称。
是那我也可以用 first next 了。
是啊。
First, we incise the skins and the muscles above the pigs.
是啊，你说怎么这个肚子切开的，怎么把这个肺掏出来的，这么简单？这他妈这不是很简单吗？我那个稿子反正很全面了。
行。
不用做什么了，我读完11遍，后面就全部你搞了。我就读到，我看一下，大概是。
你读到那个什么来着？
我是读到这个地方吧。
读到这个对。
我读到这里了。
对，然后后面
是1。
不是，这个是你的，这个是你的。
这个不是我的呀。
这个不是你的吗？
我读到11啊，后面是11章了。后面这不是11章吗？
你读到那个吗？
这个这么多东西，我操！
你这个不是你的。
那我再说一下这个吧。那这个就算我了。
我是从后面那个 preparation 这边开始的，先是准备，就是开刀了要开始准备，然后这地方这个要挪。
这个很麻烦。还好我有这么多笔
记。现在就一定要投放出来吗？或者说？bronchus, pulmonary, sutures, surgical surgery, and forceps stitched pulmonary veins. Whole neck, chest, and abandon in the central sterile area. Endoscopical. Insert double lumen endoscopical tube into the patient's trachea. Insert then use the scalpel. Carefully incise the skins and muscles above Stop the blood from major arteries and veins. We can place a retractor between the skins to hold the opening, and then the ribs are now exposed. The ribs. Anesthesia and不要讲太久。那我要么删点东西，我觉得15分钟有点长。你讲多少分钟？你讲多少分钟？
快一点，我什么分？我多少分钟？
行，我大约我看一下我这个，感觉5分钟得至少有。
5分钟好啊，我有5分钟。我读得很快就。
话说待会儿这边有坐人吗？
应该要做。
坐人的话得起来眼神交流，否则就读稿子。实在不行，待会儿看摄像机吧。
Anesthesia.
啊
？medication
挑个别的介绍呀，肯定不能全部介绍，全部介绍不成傻逼吗？我就打算是怎么打算呢？这些 general 的这些介绍一下，前面那些不重要的 specific 的这些特别的东西就介绍其中的1、2个，没了。那读名字的话，其实你觉得我有必要全部读出来吗？虽然我全部查了。
不需要，你就说一下这个 list 是啥东西就完事儿了。
OK。
找2个例子说的。哎，我不要了，你读出来他们也不知道是什么意思。
操，也是。行。
读出来就知道。我不看发音的问题。
You having Mr. Solo's class?
Anesthesia.
Anesthesia.
I'm just really nervous and some sweet food.
What?
I was nervous.
Are you also in Salt class?
Yeah.
Are you in Salt class?
Yeah.
What's your average for the class?
David,
9.
how are we doing?
Michael, what's your average for that class? What's your average from Mr. Slominski's class?
About 85.
Do I have the lowest average here?
What? What's yours?
Do I have 80?
Just 80?
Yeah.
The 6th class is actually really difficult.
So how do you have it?
You know Miss Mantooth's class? They have a score above 100. S plus. Yeah. And they don't have any final stuff, just one final exam.
105.
Just
A plus.
Yeah, they need some audience members. So.
那我们可以在年龄时候就这样，我这样可以。
Yeah.
after I finish my presentation, I'm leaving and I come back because I have another presentation downstairs. Is that okay with you?
Yeah. Do what you guys do. I just want, like I said, they need some people. Michael, you guys ready?
Yeah.
All right, get it up. Let's go. Get up there. Get set. Narragildi, can you just listen but watch and make sure that they kind of stay inside the camera? Because this is the YouTube video that's running, but it's a 30-second delay.
I don't know this app.
This is the streaming app.
No.
Okay. No, you don't have to do anything. Just make sure that you can give them signals that if they get outside on either side that they're in between. You know what I'm saying? And I'll be running in too. Okay.
Okay.
Nargildi, who's your partner?
Jonathan.
Jonathan. Okay.
He's a fantastic person.
Where's he?
I don't know.
How do you know where's your partner?
He said he's in Dayville in Henry's room.
What?
In the room, I mean.
Ah?
Yeah. He's trying to find the physical copy of this. You just all ask him. He's in your room, like looking for stuff.
Ah? Why he's in my room?
I'm kidding, Michael.
What did you say?
Michael, you say I'm kidding. But like I'm joking. Go.
YouTube 的电脑。
I am Mr. Solo. Sitting right here. I'm teaching a class.
I'm Mr. Sumner. Not our turn yet.
Go, let's go start.
Start. You can go. You can start first. You can start.
No,
You can
we
just
start
go.
at 45.
No, just start now, guys. I have to leave. I have another presentation downstairs.
Yeah, just go for it.
No, I have to present after you.
So just go first.
We
My
have to
partner's in
wait,
here.
Mr. Solo.
Yeah, we have to wait, Mr. Solo. Yeah, here he is.
Well, I'm not going to stay. So
Wait.
you guys are going to need to do this.
Huh?
So I know we have a small audience, and I'll try to get a couple more. All right? You guys want to wait a few minutes? We still got 5 more minutes before we're officially.
Nargildi is on a hurry.
No, I'm just telling like they have to start with us. I told them they don't have to wait for you to be here.
Yeah, but if you want to wait a few more minutes to get a couple more people in, that's fine.
Okay.
Okay, so we'll do that. We'll wait a couple more minutes.
Okay.
But remember, you guys can stand on either side, but stay close to that. You're out of frame, Michael. Now you need to stay right there. Can't move to your left. And remember, use the microphone. Pass the microphone back and forth.
Can I stay here?
Yes, you're good.
Yeah, and you can go over to this,
How about here?
David.
Oh.
That way that's why you're a little bit off screen. You see what I'm saying? So again, you can just kind of share it. Just do the best you can.
Oh, okay.
Okay? Just do the best you can.
要不我站这儿吧，我要看这个电脑上，你站这边。
It is recorded on YouTube, but it's not for any purpose other than just stream it out. So you're
哦，
你在干什么？
他这个投影这样子也会出事的啊。哦，
这个是给你另外一
So
个，
make sure I see that group that
这样子啊，
这个放下来。
没有想象中的那么高科技。
I want to try to keep someone on schedule with you guys.
不，这个你要看情况，
我帮你切屏，你打你，我帮
6:42
你切
tomorrow
屏，
morning, so
你不知道
I
我
gotta
会
get
在
them
哪
before they
里
go to work, right?
左右，强。
Jessica, am I really press actually watching?
No, definitely not.
My parents don't even know what I'm doing. I don't even know what I'm thinking about.
My parents what is that? What is that? Are we going here?
Oh, it's my M&M's.
And then they think he says cube butt.
Oh yeah, I said cute.
Give respect to them, Eliana.
Hi.
You're too loud. Respect me.
Respect
You're a respectful girl.
I know, I am.
好吧，要不开始？
这就开始了啊，他这个已经开始录了吗？
不是，它一直都是直播的，
他让你的观众多远？
那就等到45分好了。
45分准时开始，好吧，不多等。
哦，
那
这个
那索罗不看直播的，他怎么评价我们的东西啊？
索罗，我估计这个不用给分的，那这个 video 可能要打分，但是哎，强行跳过那个配置是不是没了？
啊？
这个配置应该100%的没有了吧？是吧？
啊，是我删掉了。
OK，
你不放心检查一下吗？
不用了，删了
Earlier
就删了。
today, I had my cap on like this, and I forgot to close it, so I lifted it up, and it spilled all over me. So,
That's unfortunate. Bad experience.
好像
拿个
没有。
椅子坐着吧。
我
需要颇有索罗的风范。
你想屎
I
啊
was dramatic, like, there was ice on
你
the ground.
你
I was crying.
乖乖站好，垃圾桶旁
It
边
was
站
pretty
好。
funny, but like, I was like,
这垃圾桶不衬配我的风格啊。
yeah, it's only school day.
Oh, that's crazy.
好了，
We're just walking wet.
要不
几点钟
开始了？
到了
44。
44，再过1分钟，
You go wet.
没人了，开始了，关
No,
我。
it was like the last class.
Oh, starting now.
你别关门，他会进来的。
不关门，待会儿万一奇怪的东西进来。
关一手灯好。
Ivan, hi Ivan.
我操！
哦，别吧，这个
Michael 宝贝，
别搞啊！跟你讲，待会儿他直播的时候莫名其妙出现了一些奇怪的生物啊！待会儿。
What？
来，
专门来看你们的呀！
过分了。
好了，开了。
那你拿麦了，麦。
We don't have to present till 8:15, so we got a lot of.
Okay, so you can go back and forth.
Yeah, that's what we're gonna do.
The, probably mostly in this room just because
Yeah, it's all.
there's no parents involved. So you guys ready?
Yeah, let's go.
Ready to go? Feel free to ask questions, guys, okay? Give them their audience, okay? Go ahead, Phil.
Hello everyone, I'm David and this is Michael. Now I will present you our surgery project. Me and Michael are the surgeon during the surgery. Here are the background story. The patient is named Ivan, who is a 45-year-old male. He was a worker in a chemical plant and the working condition is harsh. And he breathes in contaminated air every day. So that damages his lungs, and this ultimately causes him coughing. At first, the symptom is not different from catching a cold, so he did not pay attention to the symptom. And the symptom then become worse and worse. Other symptoms such as shortness of breathing also occurred. He went to see the doctor, and he described the symptom as, I can't get enough air in. That is what a person who has lung disease would say. After several lung tests, he was diagnosed to be having this COPD, a chronic obstructive pulmonary disease. Unfortunately, his lung cannot be cured because it is too late, and he's now at risk of developing lung disease, or like lung cancers. Now I will present you some basic information about COPD, the chronic obstructive pulmonary disease. COPD is a general term to describe a type of lung disease that caused by the blockade of air channel in the lung. These diseases include these. First one, emphysema. You can see a picture of X-ray showing a lung that is diagnosed with emphysema. The second one, chronic bronchitis. Chronic bronchitis is caused by the blockade of the bronchial tubes. The third one, the refractory asthma, which cannot be cured by common asthma medication. These types of lung diseases ultimately cause the COPD. Now back to the patient. Oh wait. Now back to the patient. his lung has to be replaced, and we need a donor to donate the lung to him. It is not easy to find a donor because the donor's lung must be matched with the patient's lung with every single characteristics. These factors significantly decrease the postponed surgery until a few weeks ago. A donor called Tom wanted to donate his lung to help the patient. Each characteristic of the new lung, such as blood types, are matched. And the donor does not have a heart or lung disease or any smoking history. The surgery can now be performed. Before talking about how we did the surgery, I would like to give you a little bit of information about the history of lung transplant. The first human lung transplant was performed by this guy over here, named James Hardy in 1963. Here's a picture of him. Now it's the preoperative plan. Before the surgery, the patient have to be involved in the preoperative plan. Here's an outline of our preoperative plan. There are 3 major steps of our preoperative plan, which is vaccination, functionality test, and general anesthesia. The first part is vaccination. The patient have to receive these 2 kinds of vaccination. The first one is called pneumococcal conjugate vaccination, or PCV13. It can defend the body against 13 different types of pneumococcal bacteria. This bacteria can cause serious disease and illness of the lung. The second vaccination is called DTaP vaccination. It can defend 3 types of bacteria that can easily enter the body when the body is cut open. After the vaccination, several lung tests will be performed. Here's a list of required lung tests and some basic information about them. These tests will collect that data for the patient to perform the surgery. And this image shows a typical X-ray image of the lung. Next, the heart test. The reason why we want to perform a heart test is the lung basically connects to the heart. The circulatory system is one system that connects heart to the lung. So we also want to make sure the heart is functioning correctly. And we also want to evaluate how much pressure the heart can take when we do the lung surgery. Next are those minor tests. Those are things like blood test, urine test, or stool test. Those are really basic tests. And here's a blood sample for blood tests. Next one is general anesthesia. The general anesthesia is an inevitable process before the lung transplant surgery. Under the condition of anesthesia, the patient will not feel pain at any level. Before delivering the general anesthesia, the patient will not feel pain, and an initial intravenous injection is needed. After the injection, the anesthesia will be performed by the patient inhaling the anesthesia gas, such as nitrous oxide, and surgery will be safe to go.
So next So next is our preparation for the surgeon. First, we need to wear appropriate protective clothing. This clothing will keep the surgeons away from the contamination of the surgical site. And also, we need to wear head cover, mask, and gloves. Because it is important to not let the skin exposes to the contaminated environment of the surgical site. And before the surgery, we need to wash our hands. Hand washing is the way to remove dirt, grease, and potentially contaminated materials from the skin. About the family members of the patients during the surgery, the family members of the patient will be waited outside. The surgery will last about 6 hours. They will be invited to the waiting lodge and wait there for 6 hours before the surgery ends. And about the procedure. During the surgery, we need to expose the patient's whole neck, chest, and abdomen in the central area, and insert a double lumen extracorporeal tube into the patient's trachea. By using a scalpel inside the skin and muscles above the 6 interstitial spaces. And then we need to quickly using forceps to stop the blood from major arteries and veins. We can place a retractor between the skins to hold the opening places to make it much more convenient to do the surgery. Now the ribs are all exposed to the central area. We can use a scalpel divided the pulmonary vessels first, then divide the bronchus. We should carefully take the left side lung out and prepare the donor's lung, and put the donor's lung replace the patient's lung. After we replace the donor's lung, we should carefully release the retractor on the chest and using surgical sutures stitch the inside skin together. And use those bandages cover the incision of the patient's skin to prevent infections and potential harms. And after that, we can just release all the tubes from the patient, and the whole surgery is done. So during our surgery project, we don't have a human being to do the surgery, so we replace a pig instead of the man. We first need to incise the skin and the muscles of the pig's tummy, and then open the piggy's tummy, and then we find the lung we need to replace. After we replace it with a new lung, we can close it. We can close it and then using the surgical sutures and stitch the incised skin together. And then we release all the bandages and also the stitches around, and finally we finish the pig's surgery. And then after this is the post-operation ICU part. After the surgery, the patient will be placed to the ICU, which is called intensive care unit. This place provides intensive treats, medicines, and will analyze the data of the patient to keep him safe. Next is the medicines part. So these medicines are the specific ones for the lung transplant. For example, the tacrolimus, this one, which is a drug that's used to lower the risk of the organ's rejection. And there's also some general medicines for the lung transplant surgery. Here's the general medicines. So the first one is the antifungal medications. It is used to treat fungal infections, which most commonly affect your skin, hair, and nails. And it can be worked by two ways. The first is to killing the fungal cells, for example, by affecting a substance in the cell walls, causing the contents of the fungal cell to leak out and let the cell die. And the second way is to prevent the fungal cell growing and reproducing. So the second one is the antivirus medications. This is a drug used specifically for treating the viral infections. And next one is the antibiotics, which is this one. This is a drug substance active against bacteria, and it is the most important type of the antibacterial agent for fighting bacterial infections. Antibiotic medications are widely used in the treatment and prevention of such infections. So next is the activities you can do after the surgery. The patient can change their position in bed and walking and prescribed exercises to promote the circulation. Good blood flowing discourages the formation of the blood clots and enhances the healing. The most important thing to prevent blood clots is early ambulation. Most patients sit up in bed and walk up assistance the day following surgery. If an assisted device is needed, for example, a walker or a cane, a physical therapist will teach the patient how to safely walk, climb stairs, and maintain balance. Each day, the patient is encouraged to increase physical activity and to be as independent as possible. This includes personal hygiene, getting in and get out of bed without assistance, and walking. Usually, after a couple of weeks after the operation, patients can see their surgeon. The surgeons will examine the patients again and check to make sure they are recovering well. During the appointment, the surgeon will explain the results of the surgery. The surgeons may tell the patients about the stage of the cancer and will explain if they need further treatment or not. The surgeon can also give some advices on any activities patients need to be careful with. Following up appointments usually take place every few months. Doctor or nurse will check on the patient's recovery and may run some simple tests, such as blood tests. This is a good opportunity to talk to for the patients to talk to their doctor or nurse about any concerns they have. Furthermore, the patients can develop new symptoms. Between the follow-up appointments, if they have new symptoms, they can also contact their nurse or doctor. So next is about the food that we can eat after the surgery. So there are several kinds of foods patients shouldn't eat surgery because prescription pain medicines, for example, the opioids, are often used in the daily life following a surgical procedure and have a known side effect of decreasing the movement of the intestines. While some foods can help prevent or treat conceptions, and there are other foods that can make conceptions more likely. conceptions can increase patients' pain level and can place additional stress on their incision. So it is important to avoid whenever possible. Then those are the foods that are likely to cause conceptions. Those are the foods that are likely to cause conceptions. For example, the dried or dehydrated foods. These include dried fruits, beef jerky, and some types of potato chips. And also the processed food, cheese, milk and dairy products. Here's some food we can eat after the surgery. For example, the whole grain bread, which is used for, which is made by whole grains, and we can choose those ones in darker color because white bread is typically too refined to be a good resource for fiber. And also the whole grains. Then this would include corn, oatmeal, and other grains, and fruits, vegetables, and cereals. So here's our word cited page and picture cited page, and that's the answer for listening.
太紧张了，大哥。大哥，太紧张了。读不准了。
用你的用完了。
江苏就菜了。
是哪一个点？这是等会儿看一下。哎，不要点。去找所有。
今天是不是没有产品啊？
不行，要不你自己可以自己吃吧。Mr. So we can get in.
Oh, you gotta put that code in.
Yeah, we are.
It's still not working?
Okay.
There we go.
Yeah.
There you go. So yeah, just make sure you're gonna stay near this corner, because if you don't, then you won't be seen on the camera. And you can, like I said, you can get over into this wall area. So you don't block any information.
Here's a picture of me and my grandma. My grandma passed away.
Just pass this back so they can hear you, because they won't be able to hear you.
So my grandma passed away in her age of 54 years old in the winter of 2008. She passed away so early that I can only recall her face, seeing her pictures. I remember the last met was in a hospital in Beijing. She lied in a bed, closed eyes, with no smile on her face. When I was young, I thought it was God, take her away from me. But little did I know, she was died of uremia, which is a kidney disease. So that's part of the reason why I chose kidney transplantation as the topic of my project.
So this is Hermione and this is Jessica, and we are doing renal transplantation for our surgery project. So here's our roadmap. We'll do the introduction first, and then following with the patient information and story, and then it's the pre-operative plan, and also the surgery procedure, after surgery, and then the conclusion.
The first section is the introduction. So what is kidney? The kidneys are two bean-shaped organs, each about a size of the fist. They are located just below the rib cage, one on each side of your spine. Why are kidneys so important? Your kidneys remove waste and extra fluid from your body. Your kidneys also remove acid that is produced by the cells of your body and maintain a healthy balance of water, salts, and minerals.
And about surgery background information, the scientific name of kidney transplantation is renal transplantation. And the purpose of the surgery is to help the patient gain better life qualities and prolong patients' lifespans. And the principle of the surgery is to replace the diseased kidney from a healthy kidney from a donor. And the surgery is usually lasts 2 to 4 hours. And the symptoms that the patient may have before the surgery include uncontrolled high blood pressure and diabetes and so on.
So the historical background. The history of kidney transplantation includes countless setbacks and unsuccessful efforts. These cases build the success of the surgery today. The first successful transplantation was done in 1902. The transplantation was done on a dog kidney. And from 1988 to 2000, a numerous number of kidney transplantation surgeries was performed, including 30% of the kidney transplants.
So about the risks that behind the surgery, the risk will include blood clots, bleeding, infection, and block the ureter, and so on.
So here's the procedure in brief. Just basically replace the diseased kidney by a new healthy kidney. And we'll show those procedures in our video later on.
So about the successful and failure rate of the kidney surgery. About 4% of the deceased donor kidney transplant recipients will live within 1 year after transplant, and in 21% of cases will live in 5 years after transplant. And among living donor kidneys transplant recipients, failure rate is about 3% for living 1 year and 14% at 5 years.
The second section is patient information. Sorry. It was September 26, 2018. The weather was cold and wet, with a smell of muddy dirt. I was in room reading a book until I heard someone was knocking on the door. I opened the door and saw the pale cheek of an unknown woman and a lovely little girl with a dark brown under-eye circles. "Doctor, please, I need your help," the woman said. "Please come on in." I let them two come into the house. Then the woman began to tell me about her daughter. My 10-year-old daughter, Mia, was diagnosed with uremia 6 months ago. At the beginning of 2017, she said she always felt boring. At that time, I did not pay that much attention, thought it was not a big deal. However, a few weeks later, Mia said she was really sick, and then I brought her to the hospital for a urine test. The doctor told me she was diagnosed with uremia. She took medical treatment almost every day, but her health condition did not show any sign of improvement. The woman then pulled out a pile of medical record from her tote. The woman then begged me to save her daughter. I said I would try our best to make that happen. I also told her that for Mia's current situation, a kidney transplantation is needed. We gave Mia and her mother a kidney matching test. Unfortunately, the result turned out to be unsuccessful, which means that they need to be someone who willing to give his or her kidney to Mia. After days of finding donor, one day we received a letter from a famous businessman, Michael, a 56 years old, healthy but no children man. After the result coming out, which their kidneys was matched, Michael said he's going to pay the money for the whole surgery.
And then we enter the section 3, which is preoperative plan. So the patients and her parents are required to sign an agreement about the surgery in case there is any accidents happen during the surgery. And both of the recipients and the donor should take a series of physical examinations as well as mental evaluations to make sure they are both ready for the surgery.
So here are some tips before the surgery to give to the patient. For example, like do not eat a heavy meal the evening before surgery, take the first dose of anti-rejection medicine, take a shower, and do not eat or drink any liquids like the night before the surgery perform.
So we enter the section 4, which is the surgery procedure.
So here are some tools that we use. Basically some clamps, scissors, staples, and stitches.
So about surgery procedures, first we will make an incision, just like the picture shown, and then the surgeon will push the peritoneum up and in and find the place where kidney had. Then we will free the kidney and make dissection of the renal pedicle and separate and cut off the ureter and cut and take out the diseased kidney. And then about the process of kidney replacements, we will put a new and healthy kidney in the original place, and we will connect the veins together, and then we will stitch the incisions.
So here's the video of our surgery. Sorry about that.
这个不用，这个没有显示。没有显示。18。So first we'll make a cut on patient belly area. And we will cut it very carefully in case we cut the kidney and other organs.
So basically we see the kidney already and ready to put it off.
So here we are doing the process of free the kidney. So here we are cutting off the veins and vessels. And now we remove the deceased kidney from the patient's body. So now we find the donor's kidney, which is a healthy kidney.
That's a good one. We basically want to connect the new kidney and the tissues together, and then medicine is going to repair.
And then we use the scissors and tools to stitch the incisions.
And basically, that's the final step for the whole surgery.
And we do this process carefully in case we stitch other organs.
So we're finding spots here.
And finally, we do the final step, that is close the skin cut.
So that's the end of the surgery.
And then we enter the fifth section, which is after surgery.
So your immune system will never completely adjust to the new organ. Therefore, you will be taking medicines to suppress your immune system for the life of your kidney after transplant. In most cases, we will subscribe 2 or 3 different medications so that each can be given to the lowest possible rate of dose. By doing the combination of different medicines, we can maximize the overall effect but minimize the individual side effects.
So here are some cautions that we need to prevent after the patient do the surgery. Like the patient needs to clean their food before they eaten, and the patient is required forbid to drive for at least 2 weeks, and the patient has to be quit smoking and carefully consider getting a pad and avoid strenuous lifting for at least 6 to 8 weeks.
Having a rest is important. The surgeon will schedule appointments for patients to check her physical condition constantly.
So for the conclusion.
The surgery came out to be very successful. After 1 month of recovery, Mia returned to school for regular study, just like everybody else in her classroom. Her mother sent us her newly pictures singing her school choir. We're all thankful for the good result and feel really happy for Mia and her family.
So here are some citations for the
How
presentation.
long do you live after the surgery?
Basically, the normal person will live
It
to
depends on individuals.
1 and 5 years, and just now we introduced the failure and successful rate, which is like about 14% for living 5 years.
But you don't live more than 5 years, right?
Someone
but
it could,
depends
but
very
yeah,
low.
it depends.
Yeah. Do you have any other questions?
Thank you.
You guys are up?
Yeah.
Okay.
Did you record the one in auto?
No. This is actually, only, it's not really recording it per se, it's just streaming it, so I can live video feed. It's safe, but it's what? Good job.
Yeah, it looks so good.
Yeah, it's awesome.
Your parents.
What is that?
Why did your mom just like flat skirt? I just overheard flat skirt.
Oh yeah, no, because we're like Scottish, like Campbell, and like flat kilts, so like my parents are weird.
Like the back of her shirt.
Thank you.
I don't exist. Okay, so welcome. We did a heart transplant on our pig. So yeah, let's get into that. So first, we're gonna go over the history and background. We're also gonna go over like some other things like
Pre-op plan, and then
Like-
we're gonna go step-by-step procedure, and then we're gonna show you the video of actual surgery doing on the pig, and then we're gonna do post-op plan, and then like a small conclusion, just explaining what happened to our patient.
we're also gonna talk about the story of our patient and the coronary heart disease, which is a reason why you would need to go under heart transplant. So let's first talk about the history.
So the history of our patient
I'm-
started. Oh, sorry.
So the first modern transplant happened in the 20th century. Before then, they weren't as common, and if they barely happened, and they were usually fatal. But that changed after World War II, when more transplants was happening during, in the battlefield. And one of the leaders was Dwight Harkin, who's right here, and he didn't lose a life directly. I mean, they didn't live that long. But was able to remove shrapnel from the hearts and be able to replace them. So he was one of the founding fathers of our modern heart transplant procedures. And after World War II, it began to rise. In the 1960s, the doctors began to practice more on animals, like how we are doing today. And the first human-to-human successful modern transplant that was kind of done in a hospital was done in 1967. And a year later, another surgeon by the name of Dr. Shamway was able to do the first human heart transplant with an adult. And this picture right here was one of the most hardest heart transplants that ever happened. It was 23 hours. And there's this nurse who's just tired and worn out. And the doctor right here, he is checking, blood and all that stuff. Mom. So yeah. Now background. So here's some just general things. So to do a heart transplant, someone else must die in an unnatural cause. So if someone dies in a car crash, drowns, all that stuff, the heart is still intact, then you can still go on with the transplant. And again, you can only do a heart transplant if the heart fails and other methods fail. In our example, our patient had an artery failed transplant, and we're going to talk about him. And most people live another couple of years or so. So let's just first talk about our patient.
Our patient, we have just a quick story just telling about our patient. So there was a guy named Xander. He served his country in the city of Las Vegas. One day there was a casino robbery and the robber had a gun on him. The moment when the robber tried to run out, Xander had just arrived. Xander tried to stop the robber, but the robber had shot him in the knee. Xander had to fly to another country to get his cash for the surgery. When he landed in Singapore, nothing was foreshadowing the trouble. Xander knew that there's a significant deficit of gum in Singapore, so he wanted to earn some money. So he brought a full suitcase of gum. He then planned to sell it and make a few bucks for his surgery. When he arrived in his hotel, there was already a line in front of his room to purchase the gum. A significant amount of people gathering in the place interested security, so they arrived to make sure everything is okay. When guard realized that the guy was selling gum illegally, they called the local enforcement. Xander got arrested for future clarification on what happened. His first reaction was to call the local American consul for help, but fortunately, he could not do anything to reduce his sentence. The guy was sentenced to 2 years in jail. His knee replacement had to be operated as soon as possible, and he had to fly back to America. The condition in Singapore jail was horrible. Xander started to get very nervous and stressed out. Stress caused his blood clotted. This factor was caused Xander's heart to fail. When Xander had been found on the floor in his jail, he has been immediately sent to the closest hospital where the defibrillator has been used to start pumping heart again. He was soon later diagnosed with coronary artery disease. The doctor dies to send him to UMass Boston for CHD surgery. After the surgery, Xander was set to recovery. However, after a week of medication that weren't working for him, the doctor decided for him to go under the heart transplant surgery. After doing testing if he could go under the operation, after all the checks, he was eligible for the heart transplant. Xander was soon put on the waiters list. Fortunately, he was only the one in Massachusetts during the time wait. Doctors advised him to quit smoking and start eating a healthier diet. After 6 months, the donor had to be found. The donor's name was Jimmy Walker. Recently, just signed up to be an organ donor. After his father died when there were no available lungs, when
Just put that in your pocket.
needed the lung transplant. Jimmy lived in the small town of Warwick, Massachusetts. He lived with his wife, who was expecting a child. Although, that's a quick story of our patient. What happened to him?
So, one thing that is important to learn about heart transplant is the effects of, a heart transplant. So, a reason why a person might get a heart transplant is through a failed coronary heart disease transplant or surgery. And what basically that is, I'm just going to go quickly over what a coronary heart disease is. It affects 3,700,000 people a year. That's a year, and there's already 7,350 heart attacks in the United States. So that means not all heart attacks are fatal. There are the fatal ones and not so fatal ones. It all depends on how the person lives and all like that. So you might get a minor heart attack or a severe heart attack. So it could really so it really depends on how big or your lifestyle. So it's kind of like that. And so the heart has many tubes and veins, so that help the heart function. One of these is the coronary arteries, and the coronary arteries are basically what helps fats and lipids get into the heart to make energy to keep the heart pumping. So, if a person has an unhealthy lifestyle like smoking, stress, eating too much food, and not exercising, an excess of sugars can turn to fats, and those fats can clog the artery, so it would not be able to send energy throughout the heart, and in case of stopping it, and plaques will stop helping the oxygen get into the heart, so that can prevent the heart from doing its full functions. So if this happens to someone, surgery will happen, and what basically will happen is either this is kind of risky, but the surgeon will either go into the artery and try to clean out the fats, or what can also happen is they will take a part of your artery in your leg, and move it up to your heart to kind of reroute it. So but if that fails during surgery or something happens again, then a heart transplant will be needed. So post-op then.
Pre-op or post-op? Pre-op. The first thing a patient will do is to meet with doctors to make sure everything is okay, such as surgeon or primary care doctors. Usually a month before the test will happen, he or she, our patient is he, will be asked about overall health over the last few years. Hospitals require to talk with anesthesia pre-op nurse before the actual procedure. This talk occurs around 1 week before the surgery. Blood tests such as complete blood count (CBC), kidney, liver, and blood sugar tests, X-ray check to check your lungs, is called ECG. Electrocardiogram to check your heart. Other specific criteria are assigned to you based on your age and general health. Tests that look at the lining of your bowels or stomach, such as colonoscopy or upper endoscopy. Heart stress or other heart tests, lung function tests, and imaging tests such as MRI scan, a CT scan, or ultrasound test. The night before the actual surgery, the patient is not allowed to drink or eat anything after midnight to make sure his stomach is empty. And it will be less stuff to deal for surgeons.
So our step by step. So this is basically the steps that will happen when someone will go under. So first, once the patient has done the post-op and they are ready, first any jewelry or body piercings will be removed from the body to not interfere with anything. Then after changing into a hospital gown, IV tubes will be inserted into the arm to give the body essential fluids like water and stuff like that. Another tube will be inserted around the neck to make sure that blood is flowing and other functions are working normally, and it'll be kind of description on like a little monitor right next to them. Another tube, the floaty catheter, will be inserted into the bladder to drain it. A tube will be inserted in the stomach to also drain it through the mouth. Chest hair and other abnormalities will be removed from the chest, so the chest is clean and smooth, so it's ready to be cut open. Then the patient will be put under anesthesia, and then we'll also start breathing tubes, so the patient can be breathing, and after that the heart rate and oxygen level will be watched at all times. The chest will be sanitized, and then the surgeon will make their incision just below from the patient's neck and abdomen straight down to the belly button. The surgeon will soon cut the chest bone right in half and move it, so an easy accessible way is to the heart. The surgeon will soon move it apart, and then the body will be attached to a bypass machine so the blood can still operate around the body. The surgeon will then cut out the heart. All the arteries and veins I will get to later, and then they will soon remove the heart. And they'll put the new heart, which will be donated, back into the heart's old place. The doctor will then sew back all the arteries and veins, and then will pump blood into the heart to make sure there are no leaks. After, the doctor will tap the heart to make sure the blood start pumping and the heart functional. The chest bone will be put back together. A bandage will be put on the cut. IV tubes will be removed, and the patient will rest. So, about the heart itself, it has 6 kind of main veins and arteries, which you can see here. And what the arteries will circulate. They both will circulate blood. Arteries will pump it out, and veins will pump in. And so these kind of places over on the heart here, the arteries, the pulmonary arteries, over here and over here, they will all be cut. So an easy way will be the heart can be removed from the body, and then once a new heart will be put into place, these locations will be all sewed back up. So
and now Jonathan wants to talk about where a heart came from. He wants to read the donor's history and what happened to him.
Okay. So now let's do the post-op plan.
Okay. So you want to tell the history?
No, that's
Okay. So our post-op plan starts in 3 phases. Phase 1 begins in the hospital. Phase 2 continues in rehabilitation, and Phase 3 continues throughout your life. So I will start explaining what is Phase 1. This phase begins in the hospital. Phase 1 begins as soon as the second day after your transplant surgery, when you were asked to sit in the chair or stand and walk around the hospital you were waking up in. That was the first step in taking action, tailored to your capabilities to restore your mobility. The time in the hospital is very valuable and should be used to make sure that when you go home. But before phase 2 starts, you remain active. During phase 1 is not how much you do, but that you begin a consistent and frequent pattern of pace, like exercise and rest activity. You are, after all, recovering from major surgery, and that's a very important part after phase 1 because like they basically put you dead, like stop your heart, and now they put a new one in, and they need to make sure your new heart is capable of like pumping all the blood through your body and like keep working. Then the phase 2 starts. Phase 2 usually takes place in rehabilitation facilities staffed by trained personnel where you can be monitored, connected wirelessly to a central station where your heart rate and rhythm can be observed, and where physical activity can be augmented with information about nutrition, medications, how to exercise safely, special information about post-transplant health risk, and psychological factors. Since it's not only physical surgery for a person, but also it's like very hard mentally for a person to know that he's going through all this tough time, and the third step is phase 3. This phase begins in the completion of phase 2 and should continue the rest of your life. The transition to phase 3 is an important decision point. In general, insurance coverage ends, and some people decide to end their formal exercise program. However, most people realize that in order to take advantage of a remarkable second chance, exercise might become a daily part of their lives. You should receive help and support from phase 2 facility contact and post-transplant team at your hospital to make the right decision. For many people, the beginning of phase 3 program coincides with going home and finding a qualified phase 3 facility in the part of their decision. If you're remaining in the local area, most phase 2 facilities will allow you to continue phase 3 program at the same place. You're familiar with the staff and the surrounding and probably have developed meaningful relationships with the fellow patients. And then you will no longer be monitored regularly, but the staff will observe and supervise you during every session. That's the post-op plan we should do. And the last thing is the conclusion of our history. So Xander survived after the successful surgery. He was able to go through the phase 1 and phase 2 rehabilitation in just under 6 months. He was able to live for the next 2 years and had the chance to say goodbye to all his relatives and friends. He had a good last few years of his life and does not regret going through all the pain during the process of surgery and rehabilitation. But he still died in 2 years.
Alright, so now I will present to you our
Video.
That's one. Here it is. Okay, I also had to speed up a bit because it was a little too, long, so it's a little sped up. So here is our pig. So after cutting into the pig, we are breaking here the chest bone. So you can see me just like kind of breaking over that chest bone, kind of circularly removing it, and then clamps will be used to keep the chest bone open while we do the surgery.
And then after we can see the heart, we had six arteries to cut and veins to make sure our heart can easily go out. So it was very challenging to find it inside the pig.
As you can see, we're kind of just trying to.
You can see the color blue and red. We tried to cut both of them, and it was very hard to sew them back together. But we were able to do it.
And as you can see, we're just trying to finalize cutting out the heart, and it is now almost done
and
removed. Pulled out.
Then we had our daughter's heart. So now we then clean out all the liquid from the pig. We can imagine that's blood. And then we have a new heart in, and we put it back in the pig. Then we get stitches, special like thin stitches that that can stay in your body forever and they just dissolve in your body. So then we sewed it back together. So you don't have to take them out anymore. So you don't have to do any more surgeries. This process was very hard for everybody. With our pig, I think we can speed it up.
This is all sped up. So
This is us doing stitching.
So as you can see, it's very hard to get like the arteries, especially at this small of a scale. So we're trying to just like really get in there, and I mean we didn't really get like technically in the veins. You kind of just pretended. Mr. Solis, hi, Mr. Solis.
The stitchings are made to dissolve in your body, so they don't have to be taken out of you, and they just like dissolve together with your veins, and they make sure that your heart, like your blood, doesn't leak out of your new arteries that pump the blood out of the heart.
So now we're just trying to. So we got the veins in. So this is the part where we are trying to put together the chest bone. It is laggy. I'm sorry. Again, these were the most kind of difficult parts of our project because it's very hard to do at that kind of scale.
And after like actually sewing back the pig, we realized how hard the job of surgeons is, because they have to be very careful to make sure they don't cut anything extra in the patient, and they have to sew everything back for many hours.
We also got a little help from other people. So.
Jonathan wants to read, while like we listen, he wants to read your like story of where Donna came from.
No.
You want to do it?
No, that's.
Okay. We can move forward where the pig's almost sewed together.
So yeah, this part we are currently just. Stop.
Moving back. Okay.
So this is the part where we are surgically putting back the tissue of the chest back together. I think Clark helped us with the sewing. So thanks, Clark.
You can see the pig is happy. He has a smile on his face after the successful surgery.
That is our pig surgery project. Thank you.
Thank you.
Wow.
直接开始，赶紧开始。对，我们3、2、1，3、2、1。Hi everyone. Today we are trying to introduce the appendectomy. So I am Long.
I'm Eric.
So the first thing we are trying to introduce is what is the appendectomy.
We're going to pause for 1 second. Okay.
Okay.
Yeah, that way, if anybody's at home is listening.
Yeah.
They are? Okay.
So if someone is using the.
Yeah, so just somebody speaking, just pass it back and forth. Keep it a little bit formal. Okay? Sorry about the interruption.
So is restart or just keep going?
No, you can go from there. I just want to check something real quick.
你就放着。
没有，他在拿，要收到音。
是那个收音。
对，我这放着。
So basically, appendectomy is a surgery that removes the inflamed appendix. Right here is the appendix. It's at the end of the cecum. And there are 2 types of appendectomy: the open appendectomy and the laparoscopic appendectomy.
So for the next, we are trying to introduce why are we choose the
appendectomy because
An appendectomy is often done to remove the appendix when an infection has made it inflamed and swollen. This condition is known as appendicitis. And here we can see the differences between a normal appendix and the inflamed appendix. Causes of appendicitis. The appendicitis occur when appendix become blocked, often by stool, a foreign body, or cancer. Blockage may also occur from infection, since the appendix can swell in response to any infection in the body. And here are 6 symptoms of appendicitis. Dual pain near the upper abdomen that becomes sharp as it moves to the lower right abdomen. This is usually the first sign of appendicitis, and then following with loss of appetite, vomiting soon after you feel the pain, and abdominal swelling, having a fever, and inability to pass gas.
so if you are doing the surgery, so there are some kind of benefits and the risk you will undergo. So the appendectomy will remove the infected organ and relieve pain. Once the stuff is removed, it will not happen again. And the risk of having the surgery is it could be burst and resulting in abdominal infection called peritonitis. And also, if you are trying to do the surgery, like most of the time, the surgery will be successful because it is easy for the doctor and for us to do. And before your operation, so we need to use the X-ray to make sure where is it, and then during the process. But during according to the research, we are finding that the pig does not have the appendix. So we regard the end of curriculum as the appendix, and also the day of the operation, like the patients with accurate appendix generally do not need the special preparation. Those who cannot eat or omit cereals should be rehydrated according to the situation. So the patients with complication of peritonitis needs to be treated with antibiotics. Like if the patients have something kind of fever, so they need to use the antibiotics to like kind of cure it. And this is the process of the surgery.
Usually, people will choose laparoscopic appendectomy because it's easier and and patients can recover it from faster than the open appendectomy. And we have a video of laparoscopic that we can show you.
So this is the video we find online. Like this is kind of 3D concept to show the people more indirectly and what is the surgery.
Oh, there will be 1 to 3 ports opened during the process. And the first one, there will be a tube that pass carbon dioxide into the stomach, so the stomach get inflated and easier to detect what's happening in there. After that, there will be a lighted camera. So this is a picture from the lighted camera that tells us where's the inflated appendix. Then we take out the appendix and remove it through one of the ports. Last we clean it with
The special liquid to clean and to make sure it was all clean inside the stomach and the end of the circum.
Yeah, that's it.
So after you doing the surgery, your recovery time depends on the surgery you had. The first one is what we just showed, and for the first one, probably be able to return to work or a normal routine like 1 to 3 weeks. And if you are choosing another surgery called the open surgery, just Eric just mentioned, you could like recover like longer than the first one because it may take um, another extra time to recover it. So what can we eat after surgery? Because the stomach activity is temporarily suspended to the after intestinal surgery. The ingestion of the water into the stuff cannot go down, and the accumulation in the stomach causes abdominal distension. So you cannot drink after surgery. Wait till until the return before it. And they are kind of the symbol like trying to from your body trying to show you when can you eat. Like the it's marked by the ability to hear the intra-abdominal ripple like purr or anal discharge, which means the fart. Like when you heard the sound from your stomach, which means you can eat at that time. And like after the 3 or 2 weeks, and the surgery is all done.
Oh, the pig we're using in the surgery is really small, so we choose to do the open appendectomy, which allow us easier to find and remove the appendix from the pig.
And the video we are trying to show, another video is our surgery. Do you have the sound for the So the first one is we're trying to keep the pig and stable the pig, and in order to let us become more easier to do the surgery. And the second one, we cut the abdomen about 2 centimeters from the here, trying to find where is it. For the next steps, we find the curriculum and trying to find the appendix. And generally remove the abdominal cavity because it may break down if we remove it hard. And we cut the appendix is this part. And we extract the stuff. It's so very tiny, and you can see it clearly. Next step, we're trying to the suture to fixing the wood by we find this in the and we use the insert appendix stuff into the circum and tie the stuff and use the tiny suture to fix it. For the final, we use the suture to bind the abdomen. And this is the final steps of the surgery and the stitching wood and from your stomach. And this is the final. So respect the pigs for their detection to the experiments because the life and the animal, not only the human or the animal, could die for the surgery. So we need to respect them. And after we did the surgery, we learned not only about the surgery itself, but also how about the surgery in general. The experimenting line does that biological surgery is so rigorous. and we cannot make mistake in any surgery, just like we study in biology. So every point, both in the textbook and the surgery, are essential. We need to be precise, just like we do in the surgery in our future life or in any subjects. And thank you. And this is our worksite page.
Good job, gentlemen. You just set that right there.
Thank you.
Good job. I think we have a small break. Who's supposed to go? Oh, you guys are next, right? All right. Go ahead and get set up. I'll be back in a couple seconds, okay?
So hey guys, I'm Amanda, and this is Brenny. So we're really excited to presenting tonight. So the project we're going to do is the heart transplant surgery, and we'll be introducing some kind of the basic information you need to know about heart transplant, and also we will be presenting our own videos. So here's the really brief roadmap. So firstly, we will talk about the basic information you need to know, and then we make a timeline to show the history of the heart transplant. And then there's a background story about our patient. And then we're going to talk about the pre-operation plan in order to well prepared for the surgery. And then the procedure for the surgery is separated to two parts. The first part is talking about the equipment that is needed during the process, and also the second part of the procedure is the specific steps. And after that, we will show our own videos. And then we'll talk about the post-surgery plan, and then we will have a brief summary and our self-reflection. So just a quick reminder that we selected and reduced some of the information in order to make the whole process easier to understand. So the real-life situation will be much more complex.
Here's some basic information on the surgery we do, and the name of the surgery is the heart transplant surgery, and it has a scientific name like usually used by doctors. It's called cardiac transplantation, and the time duration is approximately 4 hours.
So here's some basic introduction to the heart transplant surgery. So basically what happened in the heart transplant surgery is that a failing diseased heart is replaced with a healthier donor heart. Usually older people are receiving this surgery, and then the donor heart mostly come from some people who has already died. And the reason why a heart transplant surgery is performed is that it is kind of the last choice a patient can make, because the surgery usually happens when all the applicable medications and other surgical procedures have been tried, but they have all not worked. So then they come to the last choice. And then the two examples of the diseases that might need a heart transplant surgery is the weakening of the heart muscle and also the congenital heart defect. The three major characteristics of the heart transplant surgery is that it is a really high risk because it really requires a lot of the well-developed techniques. And then the patients usually live for average 9.16 years after they receive the surgeries. And I think 75% of the patients can live more than 5 years, and about 80% of them can return to their previous work and activities they enjoyed. And the two major causes for those people who died after they received the surgery is the rejection, which means that your immune system didn't accept your heart, and also the infection. So there's a really brief timeline to show the several major events.
In 1997, in the early age, the first proposal came on the American medical researcher Simon Flexner declared that tendencies in pathology, University of Human James D. Hardy of the University of Mississippi Medical Center transplanted the heart of a chimpanzee into a dying body rush on January 24th.
And one of the most remarkable breakthroughs is the invention of the heart-lung bypass machine, which is invented by John Gibbon, which is temporarily takes over the function of heart and lungs to maintain the circulation of blood and oxygen content.
And in December 3rd, 1967, here's the first try. First try also on a human is done by South African cardiac surgeon Christian Barnan. Patient Louis Wojtkowski received this transplant at a hospital in Cape, South Africa. However, he died 18 days later from lung inflammation, but it's the first try of surgery.
So on June 9, 1984, a 4-year-old kid whose name was JP from Colorado became the first successful heart transplant patient. The transplant was done by a surgical team led by Dr. Eric A. Rose, and who is the director of the cardiac transplantation at New York.
And here's our background stories of the patient. Here's some personal information. The patient's name is Stephanie, and she's a 26 years old girl from Nepal. And why she received this surgery is because she has a disease called cognitive heart defect. And when she born in Nepal, she was cognitive heart defect. And at that time, Nepal is not a development country, so it's a treatment equipment and technique is not so well developed. So, and also her family at that time is also very poor, so they missed the best time of her to get conservative treatment. And when she grew up, her heart disease became fiercer and fiercer and leads to heart failure. So heart transplant surgery is her only way to survive.
So we are going to talk about the pre-operation plan. So the patients need to go through several tests to see if he or she is suitable or eligible for the heart transplant, which is, I think, the most important part. So some of the tests she need to go over is the psychological and the social evaluation, which is to test her stress level and also to know about the financial issues about her family. And also there will be some blood tests to help the patient find a donor heart that is matched. And also there will also be some tests like the X-rays, shown here, and also some CT scan and or ultrasound procedures. And also another really important part of the pre-operation plan is the patient will be asked to sign a consent form that gives the doctor permission to do the surgery. And there will be a transplant team to help the patient to go over all of the things below.
Here's the procedures, and I'm going to introduce the tools in the surgery we're gonna use, like graspers, needles, needle drivers, and retreaters, and also cutters like scalpels, then cuts, wraps, surgical scissors, and also we're gonna use anesthesia. General anesthesia is that which could cause people's insensitivity to pain.
So one of the most special machine that used in the heart transplant surgery is the heart-lung machine. So this machine basically takes over the function of the heart and lung. So here, there's an oxygen generator here. So when the blood flow into this thing, and there will be oxygen released into the blood, which become the oxygen-rich blood, and then the blood will be pumped back to the heart, and then will be sent to the rest of the body in order to maintain your body activities. And also the oxygen exchange activity is also done by this machine, so that you have oxygen to generate energy in order to support your life during the surgery. So this is a brief summary of the step-by-step procedures because there's a lot of things a surgeon need to do. So we just pick some of the most important things. So firstly, you need to make a cut down the center of the chest. And then you need to cut the breastbone in half, and then you can separate them in order to find the location of the heart. And then you're going to put the tubes to the heart lung machine, and then the doctor will remove the deceased heart. And then when they sew the donor heart into place, the doctor will connect the blood vessels together very quickly. And then the blood circulating through the bypass machine will be sent back to the heart. And then the surgeon will shock the heart with small paddles to restart the heartbeat. Sometimes the surgeon will place a little wires in order to monitor your heart pacing after you finish the surgery, and then they will be rejoin the breastbone together, and they will sew the skin back together to complete the surgery. So we are going to show our video. So this is the first step in which we tried to cut the skin and separate the breastbone in order to find the location of the heart. So we kind of having trouble finding the heart at first. And then we were afraid that we cut the bones or we cut through some of the most important arteries. So then we finally find it. Actually, it is a little bit below the procedure we thought before. So we just make a longer cut, and then we find it. And then we begin to cut the blood vessels, the blood vessels and the tissue around the heart in order to get that out. And then we just successfully remove it. So we put the donor heart back to the pig. And then we just close the tissues and the skin together. And then we just begin to sew the skin back. Actually, this process is kind of challenging for me because I don't know how to sew things. I even don't know how to sew a clothes before I do the surgery. So, and also when we sew the skin back, we're not using our hands because the needles are really sharp. That can hurt us really bad. So we need to use the surgical scissors and the scalpels. So it is really hard for me. But I think it's fine for Brandy. So during the surgery, we actually made 2 cuts. So this is the first cut, which is like really long, and then we also have a second cut, like besides the first big one.
Like maybe up to
Yeah,
to
I think it's
here.
like, yeah, it's like here, it's like on the side. So we are not able to sew it like for one time. So we do
Because
like
at the first time we cut the pig, we couldn't find the heart and we cut like not well, and the second time we cut it thoroughly, but it's directly to cut.
So I think right now, like we're about to finish sewing the first cut, so we're going to make a knot. And also, there's a really hard thing is that the surgeon used the scissors to make the knot, but after trying for millions of times, we failed. So I just used my hands.
It's hard to like not make a knot like the surgery to tie on the scissors, and I don't know what they could do that, but
Yeah. So this is like the second cut we're going to sew.
here's the post-surgery plans. In the hospital, the patient must stay in ICU for at least 7 to 14 days. In ICU, I think everyone knows that it's intensive care unit. And on second, the patient have a tube in their throat that connect to a breathing machine, which like help patients to get breathe. Because after the surgery, maybe like patient will have like some breathing problem, and the nurse would help patient cough and take deep breaths every 2 hours. And in the hospital, like the patient could get like most carefully take care by the nurse and may get pain medicine as needed. And for the patient has special medicine to help blood pressure in heart. Like maybe after the surgery, like patient would have some like blood pressure problem. And he or she may start to drink liquids and add solid food after removing the tube, like those breathing tube. And the healthcare provider may move the patient from the ICU to a private room, and the recovery will continue. And after they leave the hospital, they will back their home. And at home, the patients need to keep the surgical area clean and dry. And second, they need frequently follow-up tests like blood tests, check X-rays, and biopsy. Biopsy is an examination of tissue removed the living body to discover the pressure and cause or extent of the disease. And the third one is to tell a healthcare provider if the patient have problems such as like fever, chill, redness, bleeding as the incision site. And fever and chill is a sign of infection or rejection, so it's important to identify that. And in the future, patient needs to take medicine for the rest of their life to fight rejection. Yeah, it's needed. And the second one is need to go over to the medical center for tests every several months. And the time and the frequency of going to see on the doctor is decided by your doctor and healthcare provider.
So here's basically a summary and a reflection on ourselves. So the result of the surgery is pretty successful. It's all things going really well in each stages, except the first one we can't find the heart, and then we just everything just reached our expectations and our goals. And the girl, the patient, finally survived.
And there's some problem we have encountered. The first one is at first we couldn't find where the heart actually located, the location of the heart, and we solved this problem. We asked our teacher about the inner organ structure of the pig, and then find out that the actual location of the heart was actually a little below than what we saw.
And also the second very big problem is one I mentioned, it's just sewing the skin together. And then actually we just we learn something from the research, and we hear the explanation from the teacher to learn how to sew things together and make a knot. But actually this is really challenging for us, and then we just realized that actually it is really not easy to become a surgeon.
And we have some further question. We have a further question to consider. The first one is maybe during the real life heart transplant surgery, there will be a lot of blood when surgeons cut the blood vessel around the heart. However, in the project, we did not need to worry about this problem because our pig is already dead, and so we considered that how the surgeon control the blood that comes out of the vessel and prevent the patient from losing too much blood.
And also, we also got question when we do the research to think about the procedure. We noticed that the doctor need to sew the blood vessels they cut early around the heart together. But during the surgery we performed on our biology class, the teacher said that we don't have that much equipment to do this. So this is also a question that we were really curious about. How do they just put the blood vessels together? So I think the really significant meaning of this project is that I really learned something the research skills, and also I really gained some knowledge about some of the something I really don't know before, and also we finally apply those knowledge in a really interesting way, which is doing a real surgery on the pig. So I think it really makes me to have more passion about science. So here is our works cited and images cited page. So thank you so much for listening.
Okay. Oh. Okay. Today we're talking about the VSD surgery project. VSD, the full name of VSD is ventricular septal defect, and we're talking about how to cure this kind of disease. I'm Clark Xu, and this is Tom Lee.
So what we are gonna talk about, the first thing is the birth of VSD surgery and background information of VSD, patient story, procedures and preparations of the surgery, pre-operation plan of the surgery, post-operation plan, which is about what patients need to do after the surgery, and the summary of the VSD surgery.
Now we're talking about the history of VSD surgery. Henry Louis Roger, the first person who invented the idea of VSD surgery, and he also was a pioneer of the VSD surgery. In 1992, Dr. Fleischmann, who came from ULN University of Germany, pioneered the VSD technology.
In 1993, Dr. Fleischmann first reported VSD technology for treatment of various acute soft tissue defects and infected wounds.
Huadeqiao and his team was the first team and the first person who introduced the idea of VSD surgery in China. And unfortunately, my grandfather was also included in this team before.
So we're going to talk about some background information on VSD surgery. So VSD means there's a hole in your heart wall separating the two lower chambers of the heart. And although VSD is pretty dangerous, the cause of VSD is unknown. So if you get VSD, you are probably in a huge problem.
So as we mentioned before, VSD is a very, very dangerous disease. So what's the affections that have? First, heart and lung need to work harder to pump blood to support the normal activities. Second, your heart will make a lot of murmur. Patient will also have trouble in eating meat or eating food. If you do not receive the surgery, the VSD will cause some damage for lungs and the blood vessels. So, treatment. What do we need to do for the VSD? First, if the holes in the septal is very small, it will repair by itself. However, the hole is very big, patient need to receive the surgery. And no medicine is necessary because there is no medicine in the world can cure this kind of disease. And after surgery, patient can just do normal activities.
So future things need to do after patients receive surgery. Patients need to check with doctor periodically. So basically, it means that after surgery, patients need to check with doctor once a week, and then 3 times a month, and half a year, and once a year. And it is very uncommon that defects will appear again. So if your surgery is successful, you are probably gonna be fine in your rest of the life. And children do not need to take any medicines.
This is the ECG that shows that is the heart, and we can see that there is a hole in the heart. And this ECG shows the abnormal waves of the heart rate, and there's up and down dramatically. So this is the ECG of a patient who had a VSD.
So what if you receive the VSD surgery in adulthood? So basically, it depends on endocarditis. So if you have endocarditis and VSD at the same time, you'll receive the surgery, but it also determined by pressure in lungs. How to prevent endocarditis? So endocarditis prophylaxis is not necessary for unrepaired VSD, and preventative treatment is necessary only for 6 months after VSD surgery is successfully closed.
So, patient story. There are 4 main characters in our story. Peter Thomas, a crazy and wild student in the university, and Amy Thomas, like a student who had a very bad reputation, and Carrie Thomas, the son of these couples, and Dr. Xu, the famous doctor who knows how to do the surgery in VSD.
So I'm gonna introduce the storyline to you, but remember this is just a fake story, so don't be serious. So my father Peter was really notorious in the University of Hong Kong. It's really notorious in the whole university. He met my mother Amy in the coffee shop, and after several datings,
they finally got married. After 3 months, I was born. I'm Kyrie. However, my mother didn't even care about me. She just played basketball all the time instead of truly being a really responsible mother. As a result, they didn't even notice my problem on breath or eating. 3 months later, I just couldn't eat at all. So they finally realized the problem and sent me to Dr. Xu, who was really specialized in VSD study. After several check-ins with Dr. Xu, including CT, ECG, or something like that, Dr. Xu finally found out that I have a problem called VSD, which means a hole in my heart. That was really terrible. I must receive a surgery, but I don't even have money at that time. However, Dr. Xu recognized my father as his best friend in the high school, fortunately, and I did get the surgery for free. That was really good. After that, I was really healthy and really interested in medical study, and right now I'm studying at Harvard University medical school to get a PhD on medical research, especially on heart.
So, if a patient needs to receive the surgery for the VSD, what procedure and the preparations the doctor need to do? First, doctor need to perform the VSD anesthesia and the breathe anesthesia for the patient to ensure that patient can breathe smoothly during the surgery. And we also need to sterilize the patient chest and put disposable surgical tool on patient chest. The incision should be very, very small, and the incision like 2 to 4 inches with now very advanced and developed technology. Doctors will insert tubes into superior and inferior vinyl cover of the patient.
So the next step is to insert tube into arterial aorta and build the general circulation, and then doctor should block the heart aorta and check the size and location of defect that is on the heart and start repairing the defects on the heart. After that, they must sew the incision back that is on the atrium dextrum and then open the heart aorta and superior and inferior vena cava.
There are just several steps that doctor need to do. First, doctor need to take off tube that in superior and the inferior vena cava and heart aorta gradually, and they also need to see the incision of the chest. Now the surgery is done.
So this is a surgery, so it must have some risks. So basically, the first one is excess bleeding and infection, and blood clot, which can lead to stroke or other problems, abnormal heart rhythm, which can rarely cause death, and heart block, which can make a pacemaker necessary, and finally, there are some complications from anesthesia.
So, what preparations that patients need to do before surgery? First, patient cannot eat or drink before surgery, and they need to stop taking any medicines. Doctor will also do some extra tests for the X-rays or ECGs to ensure that patients have a great health situation. And we also need to make sure that patients do not have pulmonary hypertension and infection of lungs.
So there are some basic implements of the surgery. We have scissors, needle, holders, forceps, special retractor system, anastomosis clamps, and vascular clips. Also, we need to use bulldog clamps, sternum retractors, valve retractors, pediatric instruments, variable anesthetic gas monitor, artificial cardiopulmonary machine, and scalpel.
What patient you do after surgery? First things that's necessary. Patients can do some normal activities like walking half an hour one day, but they cannot do any sports like running or jumping, these kind of things. And they also need to have a healthy habit. And if there are some infections or their incisions, they also need to take some antibiotics.
There are some complications of VSD also. So the obstructive sleep apnea, seizures, existing heart, kidney, or lung conditions, high blood pressure, lung infections, incision infections, blood clots, abnormal heart rhythm, heart block, excess in blood, endocarditis, and allergy for protamine sulfate.
I will explain a little bit about the protein serum. It is kind of the proteins that were used in the surgery to ensure that the patients can stay alive and they have the brace during surgery. And now we are talking about heart structures. So they are actually, because we do not have enough time, so we are just briefly talk about the heart structures. So there are mainly 4 chambers in the heart, and this is left atrium, and this is the left ventricles, and this is right atrium, and this is right ventricles. And there are some systems in a circulation system and the load system helps heart to get the blood and transfer blood to become like rich oxygen blood and to the rest of the body, also to the lungs, to support people do the normal activities.
The heart valves. So we have 4 heart valves. The first one is the tricuspid valves, which controls the blood to flow, and the pulmonary valve, which can get oxygen, and the mitral valve, which transports oxygen-rich blood, and the aortic valve, which opens the way for blood. Also, we have conduction system, so electrical impulses for the heart to contract, and SA, which means natural pacemaker, and change. The natural pacemaker's change is depending on physical demands, stress, and hormonal factors. We also have heart circulatory system, and the first one is the heart cardiovascular system, and it pushes blood to the organs, tissue, and cells. And basically, if you expand this whole system, it'll have 60,000 miles.
So what do we think during this project, and what's our feeling? So first, like we have a very clear job what we need to do. First, I need to do the most of the writing and include information like from surgery. And Tom do the most research and create footnote and several writing pieces like the story and the translations from the Chinese, because we found some professional Chinese like books about the VSD. So we need to translate it. And we spent like 80 hours doing this project. So what we learned from this project, actually because the limitation of the school cannot provide us enough implements to help us to do this, like to finish this surgery. For example, this kind of machine, it's a very, very expensive machine. And we also meet a problem that because the heart is too soft to be thin, so and we do not have the like appropriate needles to thin it. So we change our idea. We just see in the chest of a pig directly. And then we also learned that how to cooperate with each other like better, and also develop our thinking abilities and our critical thinking. Now we will show you the video of the surgery. Mr. Solo, win the sounds because we make like a pre-introduction for the.
What? It'll go through the.
How?
No. Just turn your volume up on your computer, and it should play through the speaker of the Apple TV.
Sorry.
I don't think the speaker system in the place works. See if this works. I don't know if it's going to work or not. So.
Other way.
Oops. Yeah, I don't think that. Just put it up on your computer. That probably won't do it though, will it?
So I can try.
Yeah.
Yeah.
It's fine. Just have to listen quietly.
I'm here, and this is my son. And 1 week ago, I found that he could not breathe smoothly, and he could not eat. So I just want to see Dr. C to see what happens. Hi.
BSD, which means there's a hole in your child's heart. So the one way to save a child is to do the BSD surgery.
Wait, do surgery?
Yes, it's not very dangerous surgery.
But it's still expensive. We don't have money.
You can just borrow money from that. Okay, so wait a minute. You look so familiar for me. Which high school you? No, what's your name?
Peter.
What's your last name? Which high school graduated from?
I think Worcester Capital.
Oh, I also graduated from that school.
Oh, really?
Well, who's the boy that crazy and well in the school and very famous? You're my best friend. You're Peter. Okay, so I will just save your children for free.
Oh,
okay?
Oh, you're so kind.
You're welcome.
Alright.
Okay.
换90厘米进行计算多长 Now, this is a thing that we do during the surgery. So now, first we calculate how long would the incision need to be, because the normal incision should be like 2 to 4 inches. However, it's a pig, it's not a baby, so we just calculate change it to fit the body, the size of the pig. Now we just open the chest of the pig, and we found the herd, and we just cut the herd, and we just put some pig juice out, to make clean circumstances for the pig. Now we just want to see the herd because we already repaired the holes in the herd.
So basically, what happened is that we slowly hard and the belly successfully and the surgery was done.
Okay. Thank you very much.
Alright, so me and Brennan did a lobectomy of the lung, which is just a removal of part of the lung. Our surgery is a lobectomy. The lobectomy removes one of the 5 lobes in your lungs. This surgery procedure is usually done to treat someone in the early stages of lung cancer. Surgery can also be used to treat people with tuberculosis, which is a bacterial infection in the lungs, and emphysema, an illness that can be caused by smoking, through which the elastic fibers of the lungs are broken down.
The history of the surgery. Lung surgeries have been fatal for a very long time, and only up until as recently as about the 1950s have they had a pretty good mortality rate. In part of why lung surgeries used to be so fatal is because in the earliest lung surgeries, they would exteriorize the lung tissue, which would mean they would take the lung tissue and pull it out of the body to perform the surgery. And as the 1900s progressed, doctors started to try different techniques to perform the surgery, which include single stage, two stage, and multiple stage surgery procedures. And as they attempted these procedures, they realized that the two stage and multiple stage procedures had the lowest mortality rating. And in the 1960s, lobectomy took over pneumonectomy as the preferred surgery for lung tissues.
The background of our patient. Our patient is a professional strongman and nuclear weapons scientist named Igor Yadonoisvinya. He was exposed to high concentrations of radon gas from the breakdown of uranium during a meltdown of a holding truck. He has stage 3 lung cancer, and treatment sometimes for these are deep breathing exercises along with coughing methods to re-expand the lungs.
So for pre-op tests, they may just use one of these tests, or doctors may perform more of these tests on the patient. They may perform a pulmonary function test, which is a test of your lungs and measures your lung capacity, and also checks the flow of your lungs and the gas exchanges. And then along with the pulmonary function test, they might perform PET scans, CT scans, MRI brain scans, or chest x-rays.
Questions that the doctor asks the patient before they go into surgery. Usually 2 to 3 weeks before, the patient will be asked to stop smoking, along with stopping any drugs, vitamins, or any other substances. They will be asked if they take any over-counter medicines or are allergic to contrast dye. The patient will be asked if they take aspirin, blood thinning medication, or any medication that affects blood clotting, if they're pregnant or could be, and have any family or personal history of cancer.
The procedure. So the procedure for this surgery is, first you have to make a large C-shaped cut from under the shoulder around to the top of the breast area of the patient. And once you make this cut, you have to open up the ribs to expose the lung. And any blood vessels or airways that are leading to the lobe that you are removing will be tied off. The next step is to remove the lobe. And once you have removed the lobe, you can sew the ribs shut and then sew the skin shut. And the procedure is finished. This is our video of the procedure. Here we're just finding the correct area to make the incision. As you can see, we made a wrong incision to start the surgery. And then here we just had to cut a little deeper so that we were able to expose the ribs and the lung. Next, we had to pull the skin back to expose the lung so that we could perform our procedure. This right here is us cutting off the lobe and then removing it from our patient. And then we had to cauterize some blood. And then this is just us sewing up our patient.
post-op plan. You should spend the next couple of days after the lobectomy in the hospital. During this time, there will be a tube near the incision in order to remove any air or fluid that may be in the chest. After surgery, you will be taught exercises for deep breathing, coughing methods to help re-expand your lungs. You might need oxygen for some time after your surgery. If you do need oxygen, it is most likely to be stopped before you leave the hospital. After surgery, you should move around as much as you can and walk as soon as you are able to. Fluids may be given to you a couple hours after the surgery. When you are able, you will be given food to eat.
Post-op continued. So once you've left the hospital, before you leave, you have to make a follow-up appointment with your doctors. And when you go home, you will be given instruction on how to bathe properly. And you will have to keep the incision clean and dry in order to prevent infection. And you'll have to talk with your doctor about what pain medications you're allowed to take. And the stitches or staples that are put to close the incision will be removed during the follow-up appointment.
In the days following the surgery, there will be a lot of fluid buildup in Igor's chest. As a result, multiple tubes were placed in the patient's inside the incision in order to drain the fluid. After the fluid was drained, everything went as planned. The patient was able to go home a few days after the procedure. It had no post-op complications. Unfortunately, full of pride, Igor attempted to break his deadlifting record just 5 days after the surgery. Before the stitches were dissolved or taken out, he ripped the stitches and bled to death. As a top Russian scientist, it was suspected that the U.S. had sabotaged it. The surgery had taken place in the U.S., and then World War III began.
Thank you to Brainy, Amanda, and Ajmal for filming and helping us with our surgery when we need to hold the pig open. And these are our sources. I would like to point out World War III
questions.
DJ's idea.
Hey, grab questions.
No, Jess? No.
Jesse, what's
What?
the question?
Jesse, we're just trying to get through this thing here. buddy.
Go ahead, guys. Go get up, set up Boston Beach.
Why did you guys choose Habitat?
We didn't
All right,
choose to have
let me
him
set up
die.
here.
He chose to do something that was reckless after his surgery and died as a result of that. We cannot choose what our patient does after
You
surgery.
guys,
Oh yeah,
it's
right.
KAT.
We did the appendectomy surgery. So about the appendectomy surgery, the surgery's basic concept is the removal of the appendix. And most cases, the surgery, normally you would have an appendectomy due to the fact that you have appendicitis, which is a blockage in the appendix, which causes the appendix to swell up and eventually burst. And normally there would be a blockage due to like something like an infection, and if the appendix bursts, there can also cause a fatal infection called peritonitis. So the risks of an appendectomy surgery are wound infections, blocked bowel, which is basically feces not being able to leave the body. During the surgery, if it's too late, the appendix may burst, which would lead you to have a high chance of getting the infection of peritonitis. And this isn't that common, but there may be sometimes some damage to nearby organs.
Alright, so the history of appendectomy surgery. So the first ever successful appendectomy surgery happened in 1735 by a man named Claudius Aymid. And then soon after that, in 1759, the first successful appendectomy surgery to be treated for appendicitis happened in Bordeaux, France. There were all these patients were not under anesthesia at the time, so it really hurt. In 1880, surgeries started commonly happening for appendectomy, and now with the advancements in technology, it's one of the safest surgeries to do. So pre-operation, so patient was asked to not eat anything or drink anything for 8 hours, and the patient will be given seductives before the surgery happens.
So our patient's name is Jamie Davidson, who is a senior at Worcester Academy. He's not real. And he said he was experiencing symptoms such as vomiting, high fever, abdominal pain, and swelling. So we diagnosed him with appendicitis. So the cause of his appendicitis was due to an infection which caused a blockage in the appendix. So he came to us, and later we concluded that we would be doing an appendectomy on him.
So for our procedure, the patient was strapped to a board, so its belly would be exposed.
So this was, and we also cut open the belly to locate the appendix. So this is a clip of us. As you can see, he was strapped down to expose his belly, and right now we're cutting it. And around there would be where the appendix is.
And then soon after that, the appendix would be then clamped, stop bleeding.
So as you can see, that's the clamp right there. In order to secure the appendix, we clamped it to the base of the appendix. And then after we cut off the appendix, as you can see here.
And then soon after that, the patient's belly was stitched up.
Before that, we also stitched up his appendix, as there was an opening that we had to close. So this is a clip of us stitching up the patient's belly, which was the longest procedure in the whole surgery.
So for after the surgery, the patient will feel very tired and weak for probably about several days. Patient's stomach might be swollen. Patient was likely going to have stomach problems and constant headaches. Patient should avoid any strenuous activity like working out or lifting heavy weights and everything. And then after undergoing the open surgery, about 3 to 4 weeks, you'll be returning to your usual routine. And the patient should take good care of the incision so it can heal correctly and it won't get any infections.
Thank you.